Hey, are you alright? Are you alright? Good morning, Mouse. Good morning, 14. New case. Heart attack. His catheter is clean, and the echocardiogram doesn't show any abnormalities.
Not interested, Joe.
Fatigue, night sweats, electrolyte imbalance, and weight loss preceded the heart attack.
Stress could explain everything. Is that what HFE?
Athlete's book covers that. The kid's been wearing sneakers all day.
Yeah, good idea. Ignore the symptoms.
The kid's been hanging over a toilet ever since he got here. The persistent vomiting could have been caused by an increased intracranial pressure, maybe a tumor in his brain.
Sure. Heart problem here, you're focusing on the brain. That daughter's a neurologist in your room.
Right, the itchy feet. If only as a podiatrist.
It may be a peptic ulcer, explains the abdominal pain, vomiting, and weight loss.
Or maybe it was an intestinal virus that he got somewhere. The repeated vomiting could have led to the electrolyte imbalance, which led to the arrhythmia, which led to the heart attack. But the itchy feet.
Nope.
That's it? Nope.
That's it.
Mouse, this isn't a game.
But it could be.
What are you writing?
Nothing.
If you know the diagnosis already, why don't you just tell us?
How do you learn to swim if I don't take off your floaties and throw you into shark-infested water?
You can't get a diagnosis by looking at a file for 30 seconds.
Apparently you can't. Anyways, what's the game without unfair rules? 14, you get one test. Zal, you get two just because. Everyone have a lunch deal at lunchtime. If I'm right, the kid go home. If I'm wrong, this is a very cruel game.
Mouse was on this page, and he got that annoying "I'm such a genius" look.
What's that?
It's patient history. Our patient is a university student. He probably does drugs, alcohol. You know, Mouse didn't mock my viral infection idea. He just said it was wrong. I think I'm gonna do a bacterial culture. Take a blood sample, check for any bacterial infections, and also take an MRI, just to see if he has any brain tumors.
If it was a tumor, the intracranial pressure would cause him to herniate before lunch.
Well, what are you gonna do then?
Not telling.
Wow, you're actually gonna play into this game of his?
Aren't we all playing into his game? Might as well enjoy it.
Fine, you go do your tests, and I'll do mine. Steve. Steve. Hello, I'm Dr. Zhao. I'll be one of the doctors taking care of you. Do you mind if I ask you a few questions?
Yeah, that's all right.
Alright, how are you feeling?
A little better, I suppose. I don't know what happened the other day. I just lost all my energy and then I hit the ground.
Was there anybody sick at work?
No, no one else was.
I see.
Can I be your imaginary friend?
Who is this guy?
Don't worry, he's a doctor.
How's your feet? Does it still itch?
Is that important?
I don't know. Is it? Anyways, what kind of drugs are you into, kid?
I'm not on drugs. I did a few during my first year and then I was clean by my second. I'm not on any anymore.
Sure. Admitting the past, denying the present.
I just told you I'm not on any drugs.
Just get out of here, you're aggravating him. I'm really sorry about his behavior. Do you
Yeah.
mind if I take a blood sample to check for viral infection?
Yeah, that'll be all right.
Okay. This might hurt a little.
Yeah.
Okay. That's good, thanks.
All right.
I'll see you in a bit.
Coder?
I'm not playing your games. Could you stay still for a while? This won't take long.
How much dope do you smoke, kid?
Does he have to be here?
No, just ignore him. It's not in his lungs.
Never said it was. You went from 2 packs of cigarettes to 0 in a day. Cold turkey. How did you quit? Patch? Gum? Hypnosis?
It wasn't really like that. I sort of just lost the taste for it.
Interesting. Sounds like one of the symptom things.
He's still puking. He had a heart attack. It's definitely not in his lungs.
Never said it was. Brrr, ice cold.
Get out of here.
I'm injecting an anesthetic in order to place a scope down your trachea. It's to check for any peptic ulcers. Peptic ulcers may explain your symptoms. Let me know if you feel anything unusual.
Hang on. The last doctor was looking at my brain, and now you want to take a look at my stomach? What's going on?
I don't know. What is going on?
It's to eliminate as many possibilities as we can.
Okay, I guess.
Why so sad? There's still a chance that Zhao got it right. No, you didn't. The culture was negative bacteria.
But positive for hepatitis A?
Yeah, I wonder who would have ordered that test. Must be someone who knew what vomiting, fatigue, sudden distaste for nicotine, and itchy feet have been known.
Hepatitis A doesn't explain the heart attack.
No, but as you pointed out earlier, puking does. Hepatitis A explains the puking.
So what's your diagnosis then?
Hepatitis A. Don't pipe the kid full of IVIG and cure him, get him out of here by tomorrow morning.
What's it say?
ZOP, blood test for bacteria and MRI. Too stubborn to check the lungs. 14, nice try.
I guess I won then. Steve, good news. It seems like your Hep A is being cleared. The IVIG worked. Maybe you'll be gone by tomorrow even. Isn't that good news? Steve? Steve!
He's stable now. We did an ECG, MRI, and blood test. The whole suite.
This could have gotten any worse. Oh wait, it could have. You could have given him anti-cancer drugs and he would be bald by now. Which, by the way, it still looks better than both of you.
Yeah, right. It's not like you're any better looking.
We did an echo again. There's a QT prolongation, and his heart seems to have atrophy of the left ventricle.
Yeah, I got it already. We cured one symptom and here comes another one. What fits all these symptoms?
I'm telling you, these are classic withdrawal symptoms. He's a third-year university student. He probably parties 5 times a day. Alcohol, drugs, you name it, he's probably done it.
He says he doesn't do alcohol or drugs. It could be a full-blown toxin. After all, he lives in a really old house that's probably full of mold and fungus.
You believe him? He looks like the type of George Clooney with his Chardonnay.
Looking at his echocardiogram, I think he's lying to us. He's lost so much mass. It's probably because of the withdrawal symptoms. We should look into his patient history to see whether he's taken any prescribed medications.
Good, so go back to the patient and ask him about his history. He's definitely hiding something from us.
Yes, sir.
Come on, guys, can't we give him the benefit of the doubt?
No, he doesn't have that luxury right now. We don't know what's wrong with him and we need to cure him. We need something that sticks. 14, go with Zhao.
We have a new diagnosis. You are showing many withdrawal symptoms, possibly from alcohol or drug overdose.
I don't understand. I told you people already. I'm not on drugs or alcohol anymore. How could I be showing withdrawal symptoms? I'm serious.
You gotta stop lying to us. We need to know your complete history in order to treat you properly.
Is there anything you have taken in the past few weeks, even painkillers? We must detoxify your blood. You will feel better shortly afterwards.
I'm telling you people, I'm not on drugs.
Steve, we detoxed your blood while you were sleeping, and it looks like your electrolyte balances are going back to normal.
Oh, why Why is everything spinning?
It's getting us nowhere. He's showing all these symptoms, but we don't know what's wrong with him.
His blood pressure and his heartbeat is extremely low. If he goes any lower, he might go into cardiac arrest.
Let's just give him some barbiturates. Besides, I have to get back to the office.
Alright.
So we added hypotension, mood swings, and vertigo to our list. What the hell is happening?
A full detox and then seizures. This game is rigged. What do all of these symptoms tell us?
Nothing. There were no abnormalities on the non-focal neural exam. All we have are electrolyte imbalances and electrocardiogram alterations.
What's common between a seizure and a university student?
You thinking trauma?
No, I'm thinking drugs. He's a meta user. Drugs could explain everything.
The talk screen was clean.
A clean touchscreen means there's no drug in his system, but there could be still drugs in his fat cells.
If they're in his fat, why would they be affecting him now?
A keen observer will notice that he has been losing a lot of weight lately. That means he lost a lot of fat. Drugs get released from fat cells, and here we are, he's in the hospital.
But you can't test for drugs in the fat cells.
But we could pour more weight out of him.
You want us to starve him again, just so we can do another talk screen? So he can get a seizure or even a heart attack?
No, that would be cruel. Just sweat it out of him. Get him to do a low intensity exercise and take a blood sample.
Where's Mouse? Bad news. Steve has had a heart attack during his exercise. The blood test came back clean for any drugs. This means that anything affecting him is not drug related.
He's weak, he's inactive, he's bipolar. He has extremely low phosphate levels, potassium levels, magnesium levels. Hell, there's nothing in this guy's blood, it's all just water.
The kid's been puking ever since he's got here. Anything that he has eaten, he has just thrown up. We should give him an IV to give him some additional vitamins and nutrients.
Yeah.
Or else he might die before we even diagnose him.
Alright, let's go.
You know you have your own fries.
Yeah, but it doesn't taste as good as yours.
So how's the patient?
Dying.
Ah! There's a worm in my sandwich!
What's wrong?
Hey, look over there.
There's nothing. Nice talking to you, Dr. Mouse.
Steve, wake up. One of the nurses has told me you haven't been eating much. We're just gonna plug in an IV with some additional nutrients for you.
Not if you can understand us. Alright, once we figure out what you have, we'll be able to treat you better. But for now, we'll just give you some nutrients and make sure you get a lot of rest, okay?
We're doing everything we can to help treat you. However, some things are more complicated than others. Don't worry, you're in good hands. Right now, I'll just plug in the IV with...
Actually, you do not want to do that. I just want to kill him.
What?
You heard me? This cat has refeeding syndrome. Unless you want to kill him, don't put that IV in there. This Steve here is an idiot and he's anorexic. That means he hasn't been eating until he got to the hospital. His body trying to maintain homeostasis while he was malnourished. And now after we feed him all this stuff, his body is going haywire. So what we need to do is give him a treatment of several balanced, controlled input of macronutrients and electrolytes, and he'll be out of here by tomorrow morning. Okay? Easy.
Mouse, how did you know it was refeeding syndrome?
I meant some simple figures for you idiots. Right there. Here, you can see that his electrolyte was low, which is clearly indicative that he hasn't been eating for a long time. And this is how we treat him. Care to read it to us, Mr. 14?
So based on this, we have a severe case of refeeding syndrome. The patient will have to be given 1 millimolar of phosphorus per kilogram of his body weight and 80 milliequivalents of potassium in order to reestablish the electrolyte concentrations in his blood.
Oh, one more thing. Prolonged periods of starvation induce the release of glucose into the bloodstream either from the glycogen stores or protein stores. Insulin is also secreted, leading to the increase in glucose absorption. However, ions such as potassium and magnesium are also being rapidly absorbed into the cell, causing a decreased level of these minerals in the blood. And this is what causes refeeding syndrome. Hey, wake up. Come on, wake up.
Who are you?
I'm the mental genius who saved your Sario. You haven't been eating, have you?
No.
Being a moronic, anorexic person like you, that's exactly what you get. Your body was maintaining homeostasis while you were malnourished until we got to the hospital where your body went haywire because of all the stuff we fed you. We started our treatment of different electrolytes and micronutrients. You should be out of here by tomorrow morning. Okay?
Alright. Thank you so much.
Yeah, no problem. Also, kid, don't be an idiot anymore. Just eat a burger.